How to remove personal protective equipment using a case of suspected COVID-19 as an example. In this video, we will use healthcare equipment with particular design features. The equipment used in this video may differ from that available to you. The proper method of removing personal protective equipment will be demonstrated by Daniel and Marie. Daniel has engaged in patient contact, so he will be removing the personal protective equipment. Marie will assist him if necessary. She will maintain a distance from Daniel of 6 feet, or about 2 meters. Eventually, you should be able to remove protective clothing without assistance. Special care must be taken when removing protective equipment. The risk of contamination is high. First, remove the gloves. It is important to avoid contact with the glove's contaminated surfaces. Partially remove each glove by turning it inside out as you pull it away from the body. This process creates a clean point of contact with the opposite hand, allowing you to remove both gloves without hazardous exposure. Throw both gloves into the designated dropping container. Hand disinfection should take place after accidental contamination during any step. To complete hand disinfection, collect 2 to 3 pumps of disinfectant from a dispenser. Thoroughly rub the liquid into both dry hands. Take care not to leave out the fingertips, gaps between the fingers, or wrists. A thorough hand disinfection takes about 30 seconds. Now, remove the protective gown. First, open the closure located at the neck. Next, loosen the band or knot located at waist level. Be careful not to come into contact with the gown's contaminated front portion. Grasp the inside of the gown from above the shoulders and carefully pull it off the arms. Now, reach into the inside of the protective gown to remove it completely. Roll up the gown while touching only the gown's inner surfaces. Dispose of the gown in the proper receptacle. The next step is to remove eye protection. Stand upright so that the lower edge of the glasses or visor does not come into contact with skin or clothing during movement. Always keep your eyes closed when removing eye protection. Now you can leave the patient's room. You should disinfect your hands after leaving the room. Now, it is time to remove the breathing mask. First, remove any glasses worn under the eye protection. Disinfect your glasses with a disinfecting cloth. Ideally, the breathing mask should be taken off under the supervision of a trained assistant. Maintain a safe distance of 6 feet, or about 2 meters. Remove the breathing mask slowly and carefully. The outside of the mask should be considered contaminated and never come into contact with one's hands. Also, make sure to keep your eyes closed. To remove the mask correctly, grasp the lower mask strap and pull it upwards. When both straps converge, hold onto both as you pull them over your head. If your healthcare facility has not enacted measures to reuse PPE, throw the mask into the designated receptacle. If such measures are in place, store your mask in the proper location and label it if necessary. If a protective hood was used and layered under the breathing mask, remove it. Note that some styles of protective hoods are layered onto the breathing mask and may need to be removed prior to taking off the breathing mask. Now, carry out one final hand disinfection.